So this is the key danger for congenital toxoplasmosis is primary toxoplasmosis infection, and the greatest risk occurs when the infection occurs in the first half of pregnancy. The features you can see hepatosplenomegaly, and in brain you'll have this intracranial calcifications, and also you will have the ventricular dilations will be present, and you'll have chorioretinitis, which is a triad, and there'll be jaundice, and they'll have hearing loss, hydrocephalus, cerebral calcifications, seizures and mental retardation. Usually these gyration disorders, when it affects the grey matter or the white matter of the brain, usually they'll have neuromotor developmental delay. So the ultrasound features in congenital tox, there are certain features which particularly occur in case of a toxoplasmosis infection, and seeing in sometimes what happens is that the mother might have had fever in the first trimester, which you would have missed in investigations in history taking. And at around 28 weeks and 32 weeks, they'll have all these features. They'll have intracranial calcifications, they'll have dilation of the ventricles, and after that when you do a serology, it turns out to be IgG positive for toxoplasmosis. And in that case, what happens, the baby has acquired the infection, and obviously the infection would also be severe because all these are poor prognostic factors. So intracranial hyperechoic foci, which is the calcifications, dilation of the ventricles. Usually the ventricle is around 10 millimeters. Anything more than that, 13 millimeters, 15 millimeters. In toxoplasmosis, it increases in days. In 1 week, first week you would have seen around 13 millimeters. After that it will be 20 millimeters. So ventricular dilations, usually it occurs because of the obstruction. It can be because of the aqueduct of Sylvius or the foramen of Monro has been obstructed, or it can also be because of inflammations, because of the meningeal irritations. There can also be a resorptive hydrocephalus. Echogenic bowel, hepatosplenomegaly, IUGR baby, which is very important, and they will have hydrops, ascites, pericardial effusion. Sometimes intrauterine fetal death also occurs in 0.9 to 2%. So usually abortions, when the mother has acquired infection in the first trimesters, the risk of abortion is around 0.5%. And once infection has occurred, the intrauterine fetal death comes around 0.9 to 1.6, which is around 2%, 1.6%, around 2%. So this you can see, these are the intracranial calcifications in the brain. Usually periventricular calcifications it takes place. And in this you can see the dilation of the ventricle. So you can see all these ventricular dilations you can see. So it's around, first it was 10 to 12 millimeters, and in a short span it will go to 13 to 15 millimeters. So what are the prognostic significance? So usually CNS signs, they carry poor prognosis. So it depends upon the severity of cerebral damage. How much damage has occurred, it depends upon the severity. So the poor prognostic indicators are ventricular dilations. Usually this is most common in case of toxoplasmosis infection, and it is an important predictor of poor prognosis. And the baby will definitely have neurodevelopmental delay. Most of the cases. So this brain necrosis, gyration disorders are also poor prognosis. These calcifications, intracranial calcification, are they poor prognosis? These intracranial calcifications, if the fetus has intracranial calcifications, they are more prone for chorioretinitis in the infant period, and neurodevelopmental delay is less in these babies. Is less in these babies. So these three carry poor prognosis: ventricular dilations, brain necrosis and gyration disorders. Because gyration disorders, obviously what happens is that all the grey matters of the brain, everything is affected, and normally the neurodevelopmental delay sets in.